Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Before I get to today's update, I want to advise you that we are making a change to speed up the reporting of variant of concern cases. This process has now been automated, which will allow us to report the results more quickly. However, this means there will be a one-time combination of 2 days of variant cases that will likely cause a larger than usual number of variant cases being reported tomorrow. I am letting you know now to hopefully avoid undue concerns tomorrow. Turning to today's update, over the last 24 hours, we have identified 692 new cases of COVID-19 and completed about 12,800 tests. Our current positivity rate is about 5.3%. We have identified 202 additional cases of variants of concern. Variants currently represent about 19% of our active cases. We have identified the first 2 community-acquired cases of the P1 variant, which were among those reported yesterday. Follow-up is ongoing to prevent further spread. Looking to schools, there are currently active alerts or outbreaks in 363 schools, or about 15% of schools in the province. These schools have a combined total of 1,550 cases since January 11th. There are 285 people in hospital, including 53 admitted to the ICU. Sadly, I must announce that 2 new deaths were reported to Alberta Health over the past 24 hours. My sympathies go to the family and friends of these individuals and to anyone who is grieving the loss of a loved one. With step 3 delayed and cases rising, I know many Albertans are wondering where this increased spread is coming from. I was asked on Monday if there was one particular element that is driving it. Unfortunately, there is no one single sector or activity that is driving the recent increase. We have seen indoor social gatherings, outbreaks, and people working while symptomatic all play a role, along with many other factors. From a public health perspective, it would be easier if there was just one activity that was driving all the spread. Unfortunately, after more than a year of COVID-19, we all know it's not that simple. It's not just one activity or place that can put us and others at risk. Instead, the growth we are seeing is the result of the little moments in many different settings, when we come in close contact with other people and give the virus opportunities to transmit. This has always been one of the biggest challenges with COVID-19, and variants make it even more difficult. It is why we must all be extra vigilant in following the health measures in place, even when we don't feel like it. It's why simple steps like staying home and getting tested if you feel even a little bit sick, and keeping distanced and masked still matter. In many ways, they matter more than ever because we are getting so close to the end of this pandemic thanks to vaccines. We have now administered more than 512,000 doses of vaccine in the province. I want to thank the more than 418,000 Albertans who have signed up to be immunized. I know that there are still questions from some Albertans about whether or not the AstraZeneca vaccine is still safe to take. Based on all the evidence available from trials and real-world experience over the past few months, Health Canada has found that the vaccine is indeed safe and effective at preventing serious illness and death from COVID-19. The data also shows that there is no increase in the overall risk of blood clots for those who receive the AstraZeneca vaccine. In fact, the numbers out of Europe, 37 cases of blood clots among the more than 17 million doses, are lower than we would expect to see in the general population without vaccination. Having said that, it is important to acknowledge one particular outcome that has been seen with higher frequency in some people who have received AstraZeneca vaccine. In a very small number of people who received the vaccine, in the 2 weeks afterwards, a blood clot in the brain was reported. It is not clear yet if the vaccine caused this issue, but in order to be cautious, Health Canada is adding a warning to the Canadian label on this vaccine. This condition is treatable and very rare. Globally, this outcome has been reported in about 1 in 1 million doses, mainly in individuals under the age of 55. When considering this, it's also important to remember that COVID-19 infection significantly increases the risk of blood clots and other serious health issues. In fact, an unvaccinated person in Alberta between the ages of 20 and 49 has, on average, a 500 times higher risk of dying from COVID-19 after testing positive than having one of these rare types of blood clots after immunization. Vaccines save lives, both your own and those around you. I continue encouraging everyone to get their dose as soon as they are eligible. Speaking of eligibility, anyone in Phase 2A is now able to book vaccines. This means that if you were born in 1956 or earlier, you can book your appointment. If you were a First Nations, Métis, or Inuit individual born in 1971 or earlier, you can also book your appointment. There is enough vaccine for all those in Alberta eligible for immunization in Phase 2A to get their first dose in the next 2 weeks. Pharmacies and Alberta Health Services have spots available now. If you have already booked an appointment, but it is scheduled for April or later, please consider calling other pharmacies near you or Alberta Health Services. There will be an appointment available much sooner. If you are eligible and haven't yet booked, now is the time. You can book online through Alberta Health Services or book at a pharmacy near you. We all need to support each other in getting the vaccines. If you know of a loved one who is eligible, do the kind thing and reach out to them. Make sure they know about the benefits of vaccines and how to book an appointment. If they need a hand, helping someone get their vaccine is an act of kindness. The sooner that someone gets immunized, the sooner they start building up immunity and are protected. We are closer every day to protection from vaccines, but until that time comes, we need to continue putting our communities first in our actions every day. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through our first caller, please?
Kevin Nimick, CTV.
Hi, Dr. Hinshaw. Are variant COVID-19 cases spreading in Alberta schools?
There have been some schools where some transmission has happened of variant cases. We haven't so far seen that there has been a significant difference between the risk of spread in schools when there is a variant case as opposed to when there is a wild type or the previous dominant COVID-19 strain. And for that reason, again, we have continued the measures in place in schools to protect students, teachers, and staff to make sure that those measures are consistent and applied every day. And I would remind everyone that the actions that are taken both outside of school and inside of school matter, and that safe actions outside of school will protect those inside of school.
Is there a follow-up, Kevin?
Yeah, Calgary has just about 2 times more active cases than Edmonton does right now. Calgary zone, I should say, and Edmonton zone. What are we doing wrong?
Well, I think that, again, it goes back to no single particular setting, no single particular activity. But what we are seeing in many of the cases that are reported to us is that people are tired. And so some of the public health precautions slip aside. And when that happens over time, then the virus, whether it be variant or the wild type COVID, have the opportunity to spread further. It's, again, important. And I think it's also important to remember that while one particular part of Alberta, there may be increased spread right now, that doesn't mean that other parts of Alberta are safe from the virus. And the virus can spread very quickly if given the chance. And so I would say to all Albertans, no matter where they live, that every day we all need to be cautious, following the precautions and keeping our communities safe.
Operator, could you put through the next caller, please?
Bill Kaufman, Post Media.
Yes, hi, Dr. Hinshaw. I'm just wondering, given some of the controversy surrounding AstraZeneca vaccine, are we seeing any kind of reluctance at all in the public to take this vaccine?
As you likely know, we had 58,500 doses of Covishield AstraZeneca come in to Alberta on the week of March 10th. It was a relatively small amount, and we offered it to individuals who were in that 2D age group, starting with the oldest ages. And we were able to offer it to those age 60 to 64, so just those 5 years birth cohorts, as well as the accompanying 15-year birth cohort for those who are First Nations, Métis, or Inuit. And in those particular groups, what we saw was strong demand from individuals in those age groups. And so when an additional year was opened for eligibility, people were interested in signing up. And so we have administered the vast majority of those vaccines and did stop booking when we only had a very small number of the vaccines left in order to not cause problems from people who wanted to access the vaccine and couldn't. So to date, we have not seen reluctance. We don't yet know specifically when we might be receiving more AstraZeneca vaccine or exactly how much we would receive. And it's important for people to know that we do continue to watch very closely the evidence of the effectiveness as well as safety of AstraZeneca, which is exactly why I wanted to provide the information we have today to members of the public as they're considering their options. But what we know is that the risk of COVID-19 infection in terms of death and hospitalization in almost all age groups is higher than the very rare outcomes that have been reported from AstraZeneca vaccine. And we know from real-world evidence in the UK that the effectiveness of AstraZeneca vaccine is significant when it comes to protecting people from hospitalization and death.
Is there a follow-up, Bill?
Yeah, sure. Yeah, Doctor, we're hearing about a pretty serious outbreak, COVID-19 outbreak, from a Calgary restaurant. I mean, I'm just wondering if this gives you any concern about these kinds of settings. I mean, they're open for use, as you know.
We're absolutely looking into multiple different outbreaks right now. There have been some outbreaks linked to restaurants, some outbreaks linked to different work sites, outbreaks, again, linked to multiple different settings, social gatherings. And I think what's really important for people to remember is that the impact of any particular single outbreak can be contained if those who are involved in that outbreak are considering protective actions in other aspects of their lives. So what we're seeing, again, wherever the initial spread happens, is that the magnitude of the number of people who are essentially impacted in the generations of spread that follows is amplified when people are not following public health measures in multiple aspects of their lives. So again, it's not one single area that's responsible for spread, and we are looking very closely to understand if there are any activities currently that may be higher risk than others, but at the moment, again, we're seeing that the biggest risk is when people are tired and leaving aside those public health measures, and spread happens not just in a single setting, but it happens in that setting, and then it happens in households, and then it happens in other workplaces from other people in those households, and it can continue to spread with multiple generations of spread happening even in a single week. So again, the important thing is that we all continue to follow the measures as best we can every day in every setting we're in.
Operator, could you put through the next caller, please?
Lauren Boothby, Edmonton Journal.
Hello, Dr. Hinshaw. I want to ask about Grace Life Church and other places of worship that have been reluctant to follow public health guidance. With so many people in a place without masks and without following the rules, there's potential for it to be a super spreader event. So how many cases have been linked to that church? Has there been an outbreak? And how many cases are we seeing connected to places of worship in Alberta?
We have seen cases and spread, again, connected to many different settings. And I would, again, make the point that there's no setting in Alberta that is immune or protected from spread of COVID-19 if the public health rules are not followed. I don't have at hand the current number of active cases that were acquired in places of worship or in some of those other settings. But I think, again, the important piece is the fact that when you have large numbers of people gathered together not distancing, not masking, and engaging in activities like singing, which we know is a high risk for spread, that it just takes one person who's infectious without knowing it for that spread to multiply from one person to many. And so, I think the important thing is that we not wait to say, again, that a particular location, again, any one specific church, any one specific restaurant, any one specific workplace, that we not wait for that workplace or location to be affected by an outbreak before we take measures. The measures need to be in place in advance, and that would be true, again, for any setting, no matter what it is.
Is there a follow-up, Lauren?
Yeah, well, first, just to clarify, have we had an outbreak or a super spreader event connected to Grace Life? But I also want to ask about, so Dr. Bonnie Henry in BC has said they're seeing more young people getting hospitalized and dying from COVID than before. Are we worried about younger demographics getting the variant? Are we worried about more of a risk? And how are you going to respond to that?
With respect to the first question, it's again important to know that while we have not yet seen transmission linked to that particular location, that is absolutely not an indication that it is not a risk. Again, it just takes one infectious person for that spread to happen from one to many, and it would be irresponsible to wait for an explosive outbreak to happen in any particular given location. We need to apply the learnings that we have from the many large faith-based outbreaks that we have had over the past year to encourage all those, again, and it's not unique to that setting, in any setting where you have people together in person, if the public health measures aren't being followed, there's that risk of spread from one to many with potentially lethal consequences. With respect to the second question and the increased risk in younger people, we have always had a large number of our active cases in individuals between the ages of 20 to 39. That continues to be true. And we know that we have seen deaths in that age group and many hospitalizations. The variant case has been reported in other jurisdictions where it has become the dominant strain to have 40 to 60% increased risk of hospitalization, increased risk of death. And while we have not yet in our own data seen a specific increased risk, we also have a relatively small number of cases when you compare to jurisdictions like the UK or Denmark where it's become the dominant strain. So I absolutely would worry that over time, as this continues to spread, that we would see potentially increased numbers of younger people in hospital because the more that COVID-19 spreads, the more it has the opportunity to unfortunately create some very, very serious outcomes for individuals who, again, may not have even known that they were in a location where they were being exposed at that time.
All right, we've got time for 3 more callers. Operator, could you put through the next one, please?
James Keller, Globe and Mail.
Hi, Dr. Hinshaw. You mentioned last week that there have been cases of transmission outdoors apparently linked to the variants. Can you just quantify how much this is happening or how much it's increased? And considering how people were using outdoor socializing as kind of a safe alternative for most of the past year, how should people change the way they're assessing risk of being with people outside with these variants becoming more common?
I want to be clear that socializing outside is absolutely safer than socializing inside. So the point that I was trying to make when I talked about the fact that we have seen some cases is that if people are outside, but they are neither distanced nor wearing masks, then just being outside is not sufficient to prevent spread. So we have seen some cases where individuals are in close proximity to one another for long periods of time, in some cases going on long walks together while they're not distanced, not masked, and over the course of that long period of time that they are close together, potentially talking, that there has been some transmission reported. And so again, I would say that if people are gathering outside for social gatherings, they should be very mindful of being distanced or masked. If you want to be completely safe, you could do both. But if you are neither distanced nor masked and in close contact with someone, having a close face-to-face conversation for a long period of time, there is still that risk of transmission.
Is there a follow-up, James?
and just with the variants, what's the percentage estimate for new cases? How much of those, what's the proportion of variants?
We'll have to get back to you. Certainly, we know that they're about 19% of our overall active cases right now, but I don't have today's current data on the percentage of new cases, so we'll have to get back to you.
We'll follow up with you offline, James. Operator, could you put through the next caller, please?
Julia Wong, Global News.
Hi, Dr. Hinshaw. Just on the note of variants, what is your level of concern with variants last week compared to this week?
I would say that we have been seeing the variants rise since the beginning of February, end of January, when we started screening all of our cases. We have known that with more infectious variants, as has been seen in many places around the world, that they do spread more rapidly and in a more widespread way than the currently dominant strain, the wild-type strain. So I have been concerned from the beginning, but certainly what we are seeing right now is that tipping point in some locations where the variant cases are becoming close to equal with wild type, and that we could see in the future that they become the dominant strain. And again, really what this does is it reminds us that the only way we can stop COVID-19, the only way that we can slow the spread and bend the curve down, is to limit the opportunities that the virus has to spread by all of us together working hard to make sure that we are limiting the number of people we're in close contact with when we are in the same space as someone outside our own household, that we're distancing, masking, using all of those precautions, because ultimately, again, this variant accelerating reminds us that we are not through this yet. We don't have enough vaccine on board, and the only current tool that we have collectively until we have the time to get enough vaccine on board our population is each other's actions to keep our communities safe.
Is there a follow-up, Julia?
Yeah, so on that note of trying to control spread, there are longer isolation periods for household contacts of variant cases, and you had mentioned before that up to 1,000 cases are being screened per day. What more is being done to try and control the spread of variant cases?
When we identify a variant case, we notify that individual as well as their contacts that the COVID-19, and typically people would have already received an initial notification call, and we're contacting people again to make sure they understand that either the person who has the case or their close contacts, that it is a variant strain. And we are offering testing twice to close contacts of individuals who have a variant case, so that we can do our best to stop spread from happening, because we know sometimes people may have a mild or asymptomatic infection and a single test may not tell us whether or not they're infected. So we are trying again with double testing of contacts, with the more assertive quarantine and isolation, with the double notification, all of these things to try to slow the spread. But again, that alone is not enough. And as I've said before, contact tracing is a partnership, and it works only if both the people who are doing the contact tracing and the people who are receiving those phone calls are working together to limit the spread. And when we have individuals who are, again, understandably frustrated, who may be feeling that they don't want to offer information, contact tracing alone and those phone calls aren't going to be effective unless we work together with people who get those phone calls to make sure that that spread is stopped.
Operator, could you put through our final caller, please?
Matt Woodman, CTV Edmonton.
Hi, Dr. Hinshaw. I'm just curious if you guys have decided when we can expect the next group of people to be people with underlying health conditions, when they'll be able to register for the COVID-19 vaccine.
We are currently looking at the expected incoming shipments of vaccine, as well as the scheduled appointments for those in 2A. And as I said today, we're really encouraging anyone in 2A, so in that eligible age group, to register for an appointment. If they have an appointment that currently is scheduled a month or so out, I would strongly encourage them to look for other options to get their vaccine sooner. And once we're able to see what that demand is like in that 2A group, and what the incoming supply is, we'll be able to set the date for when we can start that 2B group.
Is there a follow-up question, Matt?
Yeah, I'm just wondering, given the number of variants and we're seeing active case numbers rise, the R value has been going up, positivity rate seems to be going up, do you worry we're going to have to, instead of easing restrictions like it could have possibly happened on Monday, do you worry we might actually have to implement some more restrictions here soon?
What we know is that in other places where variant strains have become dominant, that additional restrictions have been required. And we see in many countries in Europe, we saw in the UK earlier this year, that the variant strains rise very quickly, and that in some cases those additional restrictions have been needed to prevent further spread and to prevent that impact on hospitals and ICUs. What we need to do in Alberta is up to all of us, and the next few weeks really are going to be a measure of how we are all collectively making choices, prioritizing our community, preventing that spread within the current public health measures. If spread escalates, if we're seeing the spread and the transmission of our cases, and particularly variant cases, continuing to rise, it may be possible, it may be necessary to bring in additional restrictions.
Thank you all for joining us. Dr. Hinshaw will provide another update tomorrow afternoon. Have a safe evening.